Let's talk about cranberries. I mean, cranberries are the Christmassiest berry that I can think of, or at least the most Christmassy berry that you can eat anyway. They're also meant to have some health benefits. They purport, that's a good word, isn't it? I don't get to say purport very often. I can't remember the last time I've ever said purport. They claim. They also claim to have health benefits, in particular to help urinary tract infections. That's quite a thing to purport. Why are they meant to be good for urine infections, and are they really good for urine infections? So first of all, people tend to talk about cranberry juice. Any suitable cranberry juice would probably do. I'm drinking it out of a wine glass because it makes me look fancy. Alright, let's get to the point. In all honesty, no one really knows why cranberries might help with urine infections. So there's a couple of theories. Firstly, there's something called quinic acid in cranberries. It used to be thought that essentially creates a kind of antibacterial acid that goes into your bladder, acts as an antibacterial in your bladder, and stops you getting the urine infection. Turns out it's probably not that. So what is it? Current best theory, as far as I'm aware, is that there's a couple of things in the cranberries that essentially go into the bladder, sit in the urine, and stop bugs, stop bacteria sticking on the inside of the bladder, colonising it, and developing to form that infection. Sounds like a good theory. There's one main active chemical that's meant to do the job of stopping the bugs stick to your bladder, and that's something called PAC, spelled P-A-C. And whether cranberries help depends on how much PAC is in it, and whether the PAC is active or if it's been deactivated by the formulation. So cranberry juice is meant to contain active PAC. Cranberry supplements and tablets and stuff, they might have been processed, so it's possible that the PAC is less active and you don't always know how much PAC is in it, so there's a little bit of a problem there in terms of dosing. If you're taking cranberry juice, the dose isn't necessarily clear as to what's best. It's been suggested that 36 milligrams of PAC is what you need, which is about the amount in half a pint of cranberry juice. It sounds plausible. Some people have suggested that you might need twice as much. So a pint of cranberry juice a day, which is... And also it doesn't last all day in your body, so you need to stagger it throughout the day. So you need to be drinking half of it in the morning and half of it in an evening, probably. Most important question is, does it work? There has been a big review of all of the evidence, and the results are a little bit confusing in all honesty, and sometimes this is the way that medical evidence kind of stacks up, and you just have to try and figure out how it all fits together. Basically, there have been a couple of studies that have suggested that if you drink cranberry juice regularly, then it can reduce the amount of urine infections that you get. You would have to drink a lot of cranberry juice to actually get rid of a urine infection when it's there. That's probably not really feasible. It might be possible that if you are drinking your half a pint of cranberry juice split over the morning and the evening, then it could reduce the amount of urine infections you get. However, the overall review of the studies seems to suggest that that's not enough and it doesn't really reduce the amount of urine infections you get. However, for people that get urine infections regularly, to the point where they might be thinking about taking antibiotics regularly to stop getting the urine infections, not just taking the antibiotics to get rid of the urine infection. For those people, it is as effective as taking an antibiotic regularly to stop you getting urine infections. You need to be drinking the cranberry juice every day, twice a day, in order to get that benefit, and that would work out in a year. If you're someone that would normally get 2 urine infections in a year, if you drink your cranberry juice every day throughout the year, twice a day, then you reduce it to 1 urine infection. So if you're getting them a lot more, then it would kind of rack up proportionally, but that's a lot of cranberry juice, and you really need to like cranberries. One of the issues with all the studies is that most people don't like cranberries that much. Most people don't drink the juice every day, and then it doesn't work. Do you really like cranberries that much? I mean, it's alright. So overall, the evidence is a little bit fuzzy. It's not entirely clear how or why or if cranberries actually do reduce the amount of urine infections that you get. It is plausible, and in some studies it has been shown to be helpful, but you need to drink a lot of cranberry juice. You need to drink it every day, twice a day. It may have a bit of a benefit, and if it does have a benefit, it's probably a relatively small one. Anyway, that's enough today. Remember, like, comment, subscribe, and most importantly, if you can do, share the video. It really helps to spread the word, helps the channel, helps to spread the Christmassy cranberry knowledge, and who wouldn't want to know about urine infections in cranberry juice at Christmas? See you tomorrow.